Hello, everyone. This is Dr. Mike Chua, physical therapist. And yes, I am your certified dementia practitioner coach. Today, we're going to be talking about what is dementia. So, like and subscribe our video. I'll be back in a few seconds. Yes, I think we are live. Hello, hello, my Facebook friends, Alzheimer's and Dementia Support Group. Hey, if you're watching live, please comment live. Watching on the replay, please comment replay. And well, anyway, a lot of people are asking me, texting me, and sending me messages, phone, Facebook, and everything. They're asking me, what is dementia? So let's go ahead and just talk about what's Alzheimer's and dementia. And I think I'm going to have to change my camera over here because my camera is, the battery's draining. Well, anyway, let's change that camera there. So again, if you have any questions inside our Alzheimer's and Dementia Support Group, put it up in our group, in our Facebook page. Of course, if you're watching on the YouTube, please subscribe because we are going live also in our YouTube. So let me just change my camera. It's getting battery. All right, if you're still seeing me, type in, you see me. There you go. All right. All right, so let me go ahead and stop that. So again, thank you very much for watching live. If you're watching live, comment live. Watching in a replay, please comment replay. Well, anyway, so let's go ahead and share my screen. Let's share that topic for today. Our topic for today is the misunderstanding dementia. If you can see my screen, type in, you can see it, or the what you call this, the PowerPoint. So this is me. I'm a physical therapist, and I see Alzheimer's and dementia all the time. So we're going to be talking about this. We're not going to be talking about me. We're going to be talking about what is dementia. So how many chapters are we going to have in this class? Basically, we're going to have. Well, you don't see my screen yet. I guess I gotta share that. There you go. There you go. I think I'm sharing it now. All right. So this is what we're going to be talking about. How many chapters do we have in this class today? So we're basically 4 chapters. Let me see if I am actually live in the group. I guess we are live in the group. Okay, so we are live. All right, so how many chapters? We're going to be talking about the anatomy, the pathology, the patient, and the treatment of how to handle dementia, right? So where did that go? So the anatomy, we're going to be talking about the anatomy of the brain and the central nervous system. So on this discussion, we will talk about the basic background on the nervous system, the anatomy of the brain, and the function of the brain, right? So we're going to keep on going. The pathology of dementia. So we're also going to be talking about this, the different diseases that can cause dementia. What is normal aging versus dementia? What are the different risk factors of getting dementia? How to diagnose dementia? What is early onset dementia? The different stages of dementia, and of course, we're going to be talking about the normal aging and the dementia versus the not so normal aging, right? Okay. And then we're also going to be talking about the different signs and symptoms of the dementia patient, right? So, and then the treatment, both pharmacological and non-pharmacological. I'm not a medical doctor, so we're going to be focusing more on the non-pharmacological interventions. So let's go ahead and talk about this now. The anatomy of the brain and the central nervous system. So we're going to be talking about basic anatomy. What is neuron? What are their synapses? What are the four major diseases that causes dementia, right? So again, dementia is actually a symptom or a syndrome. Dementia is not one condition, so it is a syndrome. What is a syndrome? Syndrome is a collection of different diseases. So imagine just like fever, there are a lot of causes of fever. Same thing with dementia. There are a lot of causes of can cause dementia, like Alzheimer's, like Parkinson's, like vascular disease, a stroke. That can cause dementia. So the dementia itself is a symptom. Okay, it's a symptom. All right. So again, what is Alzheimer's? Alzheimer's is the most common type of dementia. So 60 to 70% of all dementias are Alzheimer's. So again, let me stop my share again. So let me stop my share. The most common type again is dementia is the umbrella, right? Underneath are the different diseases. So the most common that can cause dementia is Alzheimer's. So that's what we're going to be talking about today. The Alzheimer's. Where did that go? All right. Let me share that screen again. So there you go. So who gets dementia? No discrimination here. It is not part of aging. And people who are 65 years old and above are the one who gets dementia, right? So we're going to keep on going. Can I get dementia when I'm young? Yes. Yes, you can get dementia when you are young. It's called the early onset Alzheimer's disease. So how do we prevent it? We're going to be talking about that too in the next few pages, next few chapters. The race, obviously, there's no discrimination. It's actually affecting most developing countries because they're here in the States, they're living longer. Am I correct? Right? And then how many is affected by dementia? It says here the number of Americans living with Alzheimer's is growing, and it's growing fast. The estimated in here in America is 5.7 millions. Americans of all ages have Alzheimer's. Imagine that. 1 in 10 people age 65 and older has Alzheimer's dementia. Almost 2/3 of Americans with Alzheimer's are women. Why do you think so? Why? Because they grow older, right? They're old. They go live longer. Older African Americans are about twice as likely to have Alzheimer's or other dementias as older whites. Why? Because of obviously the eating habits. Hispanics are about 1.5 times as likely to have Alzheimer's again because of the eating habits. And as the number of older Americans grows rapidly, so too will the numbers of new and existing cases for Alzheimer's. So today, someone in the United States develops Alzheimer's every 65 seconds. By mid-century, someone in the United States will develop the disease every 33 seconds. Gosh, that is a very alarming statistic, ladies and gentlemen. So, am I sharing my? I guess I'm not even sharing my screen. There you go. Oh gosh, I'm not even sharing that screen. So, or let's just keep on going then. So again, the dementia is the disease of the brain. It starts with a cognitive problem, personality changes or mood changes, obviously, and then eventually it will have some physical problem, and then ultimately it will be a global condition, right? It will ultimately be going to be a global condition, which means it affects your not only your cognitive, your speech, your movement, your personality, your moods, and everything. So all right. So again, in summary, dementia is a syndrome. We already talked about it, which is a collection of different signs and symptoms that are caused by different diseases. Again, like an umbrella or like like fever. There are a lot of causes of fever. Same thing with dementia. There are a lot of causes of of dementia. One of them is the most common type. Again, is the Alzheimer's. So dementia is associated with aging, but it is not a normal part of aging. Okay, it is associated with aging. Age is a big factor, but it is not a normal part. Okay, a lot of people will say, no, it's just a normal part. No, it's not, but it is associated to it. More than 90% of all dementia occur in people over 65 years old. Again, that's it. It is associated with it. And then dementia often starts with cognitive and behavioral changes. And then as it gets worse, obviously it affects, it says here globally. So it affects the physical part, obviously the cognitive part, the speech part, everything, the swallowing, the reflexes, your balance, everything will be affected. All right. So, that's our quick what is dementia for today. And gosh, this PowerPoint is not really working well. Where did that go? There you go. So if you have any questions, we will try to answer it every weekend here in our private group, Jerry Have Physical Therapy, and of course the Alzheimer's and Dementia Support Group. That way we can serve you more and be the best that you can be for your clients and for your patients and for your loved ones. All right. So I wish you all the best. Be awesome, be great, be excellent, and I will see you later, my Facebook friends. Bye bye.